Hey, everybody, welcome back to the High Pass AI and Healthcare podcast. Very excited to introduce our guest here today. Vivek, would you like to introduce yourself?
Hi, Jeremy. How are you? So thank you so much for having me today. Hello, everyone. My name is Vivek, and I work for one of the biggest healthcare provider in US. It's been about 17 years. I've been working on IT, and last 9 to 10 years, I've been around healthcare. And off late, I've moved into working more on data analytics, AI, ML. So that's where my expertise are. So I'm really excited to have a conversation with Jeremy today.
Absolutely, likewise, and very excited to dive into all the aspects of IT and healthcare, and also data analytics as well. Hey, everybody, for those who don't know, I'm going to introduce myself. I'm Jeremy from High Pass, making AI a reality in healthcare. Teams like Kaiser Permanente, Molina Healthcare, and Centara love High Pass because they reduce claims processing by 30%, time by 30%, reduce fraudulent claims by 50%, save $10 million annually in fraud losses, secured exchange of health data using FHIR, automated billing operations, and automated compliance with Medicare and Medicaid. So let's dive right in, Vivek. Can you first help us break down what are the various areas within IT and in healthcare, sort of the various systems and areas that y'all have to manage that y'all are responsible for?
Sure. So if I talk about IT in general, it's more driven by the technology or the product we want to deliver to the end customer. So again, inside IT, there are multiple cross-functional departments. Everyone has to work together to bring the product out. Start from higher the hierarchy, starting from the product owner and starting from the process owner, from there driving a vision, having the company's vision to be into the reality. And there you have multiple teams. You have development team, you have a DevOps, you have tech arc teams, you have data analytics teams, you have testing teams. So there are multiple cross-functional teams who work together in order to bring a product out. So that's more complicated structure inside the IT, irrespective of, I think, healthcare or anywhere else. But when we talk about healthcare, I would personally like to think it adds one more layer of complexity. The reason being, healthcare data is much more complex, and healthcare data needs to be handled in a different way. It's all PHI data. So there is added responsibility, and also the real lives are involved. So if any mistakes are done, it's going to impact someone, and it's more impactful for the end user. And also government is involved. There is a lot of regulations, and everything needs to be followed. So there is a lot of additional layers which needs to be handled for any healthcare related products to be rolling out. And again, companies cannot roll out anything and everything they want. Everything has to fall under the regulatory services. So yeah, it is complicated, but it's on a high level. This is the different departments working together to make healthcare affordable to everyone.
Very cool. And can you give us some examples generally of the types of products that y'all have to manage?
Sure. So healthcare providers are mainly dealing with providing the health insurance. It's basically driven by multiple areas. It can be an employer providing insurance to their employees. It can be a self-funded employee insurance type, or it could be Medicare and Medicaid. So there are multiple subscribers for this. And also companies, sometimes what they do is offer only the administrative services, as in they don't own any risk and responsibility for any payment of the claims, but they will just handle the administrative services. So the TPA and ASO are one of those areas. So these are all the high level sections where the product is served. So basically how really it works is like we have monthly premium, we have a coverage, and each healthcare coverage comes with its own set of members, and how many of them can be allotted with it, what different types of insurance they can get. It could be health insurance, dental insurance, your eye care, and also what medicines you want to subscribe for to get the medicines. So all of this brought together forms the healthcare services. So either the product is more in terms of providing the entire care, as in taking the entire insurance and paying them whenever they're in need, or just handling the administrative services, or offering them with a discounted rate when it comes to Medicare and Medicaid. So broadly, these are the different areas offerings are there.
Interesting, interesting. And if I'm understanding correctly, a lot of these products that we're talking about here are customer facing, user facing, right? The end consumer of the healthcare, of the insurance. It's interesting. So at HighPass, we have multiple AI products and services that we provide, but one of them being a membership AI automates benefits enrollment. I'm curious if that's another area, right? Eligibility verification stuff. That's another area that customer facing and user facing that y'all deal with as well.
Well, that's really interesting. You mentioned about it, and be it, I mean, the AI and data analytics have really taken off in the last few years, and especially the area you mentioned where you have to have the eligibility verification when you have to offer a customized healthcare plans or any customized health services and products more suitable for them. So AI and automation, the robotic process automation, all of this plays a really big part. I see that there is more adoption on automated claims processing. As part of the automated claims processing, they automatically check the eligibility too. So that's one of the area where there is a huge demand and companies are slowly adapting to it. Compared to any other industry, healthcare is more defensive to the newer technology. The reason being, they're okay to lose money versus exposing data or being vulnerable in technology. So they they always have the a slow adoption when it comes to anything latest. But AI, since the cloud has taken out so big and AI has taken out so big, so companies are more getting the in-house solution specifically for the companies, and they are doing a lot of experiments with that. But automatic claim adjudication, eligibility adjudication is all a great source for any AI to be there.
You mentioned a very, very important point about adoption, and for a very, very good reason, as you mentioned, security, right? Privacy data. I'm curious, you personally, right, in the position that you're in, leading technology and IT and innovation and adoption of new technology and digital transformation. How do you balance, right, the absolutely critical data security side, but with also automation and yeah, I guess how do you manage the two dynamics, right? They seem to be at odds with each other. The one that you mentioned.
Sure. Security sort of forms a very challenging situation for everyone, and more so with the healthcare, because with healthcare, they can access a lot many personalized and extensive amount of data. So security is always a challenge for all the companies, and we have seen time in and again that there are threats, there are hacking, which is constantly happening, no matter how good your cyber security is. Especially when you're in cloud, that's something you are always have a slight vulnerability to it. Certain ways, as an organization, we have established a lot of ground rules whenever a product is developed, whenever an automation solution is developed, what are all the different stages and testing it has to go through. There are enough tools available which does the automated code quality check and also check if there is any security vulnerabilities. That sort of helps us. And also in terms of ethical hacking, that's one more practice which everyone adopt as have an internal team in the company to do ethical hacking and see if there are any areas to strengthen. Apart from this, a regular socializing the concept to the entire organization, ensuring each and everyone understands the importance of security and how they can be a part of making sure that security is secure within the boundaries. Those are very important. And like you mentioned about automation and security, how to balance it. If you don't adopt well, or if you don't adopt fast enough, you sort of stay back in the competition, or you won't be able to provide the required amount of services you want to do for your end customer. So you always have to make sure you are constantly innovating, automating, moving forward, but also have to make sure security is taken
Yeah.
to the side too.
And to that point, the quality of care, right? The speed that somebody can get their claim process, that could be life-changing, right? So yeah, I think even for the end customer, there's benefits of automation as well. Yeah, quality
Mm.
automation,
Yeah,
well tested.
100%. I've seen the automated claims doing as good as 99.5 and above percentage of accuracy. So for someone who is waiting in a hospital who want to get pre-approved, or in those situations, having this claim process, getting the preliminary approval pretty fast is going to be really life-changing. So
Absolutely. I want to absolutely relate to what you're saying and echo what you're saying, and really resonates with me because with HighPass, right, another one of the AI products is the AI, the claims AI. So I'm just going to do a shameless pitch here for the audience. Outcome of our claims AI automation basically increase adjudication rates by 45%. 30% reduction in processing time, which I mentioned earlier, 20% decrease in operational costs. Just the tip of the iceberg there. So absolutely, definitely a lot of real benefits to both the company and the end customer. I agree. I'm curious, because you alluded to the process earlier, and maybe some of the folks who aren't in your position listening might not fully understand. What is the process or the timeline or the work that has to be done to let's say you've decided, oh, this is what we need to do, right? And this is the benefits. Okay, how do we get there? How do we get from, hey, I think this is a good idea, to actually implementing it within the healthcare system? You mentioned compliance and testing and ethical hacking and all that. What does that actually mean? Like, is that a year? Is that 2 years? Is that multiple teams throughout the whole company, and the CEO, the CTO is getting involved? Like, yeah.
Yeah, I mean, I wish there was a standard answer to it, but there isn't. It again totally depends on what we want to do and why. Let's say if you want to introduce a new product, and then you have you time is can work with you. You can take a decision when to introduce the product. But let's say you're having a situation with a security threat, or you've gone through one of the security incidents, then you're racing against the time. You have to do stuff much more quickly. So each situation brings in a lot of different challenges. So I'll just take an example of, let's say we want to introduce a new product, and we want to reduce the cost, or let's say we want to roll out a new insurance plan which people can subscribe to and don't have to pay the high steep premiums.
Hmm.
So that has to come out from the top level, as in, of course, companies do take inputs from all the employees and the customers and everyone, but there are plenty of opportunities where they want to invest, where they want to go ahead with. Based on the vision, they will select a product they want to work on. So it'll all goes through a preliminary check of whether the product is going to work, what will be the market fit, how much time it's going to take, where we want to do it, what will be the return on investment. So there is a plenty of analysis which is done ahead of time. So I'll start from the time where we decided to go ahead and implement this as a project. With
Hmm.
healthcare, the bigger the company you have, that much more difficult it becomes to roll out products. The reason is you will have multiple line of businesses. You might be dealing with millions of customers. So even though one single product, then it adds a total different layer of suite of applications in your company. So you need to have a dedicated team
Hmm.
to build the suite of applications, handle it. And data is sort of centralized, so you have to pull the data and they have to use it for their products. So usually it's a multi-year idea they always go by, but they always try to, based on the market needs, maybe a couple of years, 2 years, at max 3 years, based on the size of the product they would like to go live. uh, but if anything smaller, you're just integrating to your existing application, or that can happen much more quickly in a couple of months.
Hmm.
But any big project you want to take over, or offer a bigger solution, probably you're looking at a couple of years of effort involved in that.
Makes sense. Makes sense. Yeah, that's sort of what we've seen as well. And thank you for breaking down the different kinds of timelines as well
Yeah.
for us. I just want to make a quick comment, and I want to move on to data analytics. But quick comment, I absolutely, I love how you answer that question with, depending on the urgency, depending on the impact, right? The timeline is different for every kind of product. I imagine during the COVID pandemic, that probably brought different urgencies and needs and timeline, different kinds of timelines to technology, right? And people be having to be remote and having to be digital and all that stuff. But I want to ask you about data analytics. So how do you utilize data analytics in what you do day to day?
Sure. Before I answer this, I want to mention something interesting. COVID brought a really unexpected sort of situation. And after that, the after effect was completely different. I'll tell you why. Initially, when the COVID hit, there was certain amount of people who are going through a lot of trouble. But if you look at the entire population, there were not many people stepping out of the work. So the healthcare utilization was less if you see the overall consumption, because there are not many people on the roads, there are not many people getting sick, they're all inside, they're all more secure. So after a while, that sort of gave a different impact as a ripple effect, because now the hospitals and the care providers, the doctors, for years together, they couldn't sustain not having any income the level they were wanting for. Then you started seeing slowly, like the health care providers might be more profitable because it's not getting used as much, but the health providers like hospitals and the doctors, they were having a different challenge to stay open. So it sort of got into that situation. Then at some cases, health care providers has to step in and bail out and provide the additional monetary benefits, do some contracts so that they can stay open, because they know that once the pandemic is over, then if there are not enough hospitals and doctors to support it, then
Right.
it's going to be again a backward impact to the insurance provider. So it's a very tricky situation, and that phase was totally different. I know I sort of segued from your actual question, but I thought it's interesting to say that because normal people may not really realize how behind the scene the
Yes.
situation transforms, but it was all a roller coaster for for all the healthcare companies during that time. But I'll come back to the data analytics side. So companies and especially healthcare, they were doing some activities with data always. There were tools before few years as well. Like we had Tableau, we had Power BI analytics tool specifically built for that. But what it has happened with the introduction of cloud or with the introduction of AI, a lot of the work can be done now, computing work can be done now much more faster versus
Hmm.
what we could have done before. So now we have even more deeper insight to the data and how we want to analyze and use it and make decision out of it. Couple of examples with the introduction of Apple Watch. Now people can really see how health or the vitals are having. But this is a lot of data. There should be a way for us to keep this, process it, and do the analytics. And now we multiply this with all the number of people you have, and then we are talking about tons and tons of data. There you need a big data solution. So with cloud, with AI bringing in, they are sort of helping to do this bridge and give more wings for people to innovate. But in our case, we are definitely data driven. We make a lot of decisions based on the data, and we are using that very extensively. We have been using that. We have dedicated platforms and applications which deal purely with data analytics, and we have teams who will be purely working on the customer need and what decision to make. The data definitely helps with that.
Absolutely. I'm glad you brought up AI. AI has a lot of use cases. One of the best use cases, I believe, is looking at a lot of data very quickly, understanding it, and being able to answer data analytics questions. Being able to answer, oh, so this is the pattern we're seeing, this is the trend. Then the action, we should probably do this, or this is a problem, or oh, this is actually going great, we should do more of this. So absolutely. I'd love to shift gears a little bit and learn a little bit more about your personal journey. You mentioned, was it 17 years in
Yes.
the industry. What would you say is your most important career learning?
Okay. Um, Career learning, I think I would still consider still learning. Every day is a different challenge, and every year you mature, you feel you could have done things better when you were younger. It's always the same feeling. So learning wise, what I've learned is when you're working in technology, and a couple of things are very important, and especially for the young generation who are planning to start with the technology side. You have to be curious. Definitely, you need to have the curiosity about why things are in a certain way, why it can't be in a certain way. The more and more curiosity you have, the more and more knowledge and depth you will develop. And also, when you have some purpose driven work, like healthcare is very much purpose driven, we have the people getting benefited or impacted with the work we do. It also gives more strength to us and more energy to work. I would say find your need, find your reasons why you want to be in a technology. Probably helps you to really be at your best. So these are some very simple, easy learnings I have from my side. But I think I would definitely say be curious, be always have good networking, learn, always be open for the new learning, new challenges, and find your purpose of why you want to do what you're doing. You will definitely be in a good position.
100% agree. And me personally, in my own life journey, I'm starting to learn exactly what you're learn what you're saying as well. Curiosity seems to be at the foundation
Yeah.
of, motivation and reason and purpose, goals, and then energy, right? And preventing burnout, and you alluded to earlier. So I'm curious. I noticed that you are a mentor, and you
Mhm.
coach, and for Crya, they're a YC company. You mentor, it looked like you mentor the founders, and then also you're president of the American Association of IT Professionals. Um, I'm curious, I guess, where did the motivation to get involved, right, as a mentor, as a coach, giving back to the community, where did that come from? Why is that important to you? Why do you make that sort of part of your life?
Sure. I mean, when you're mentoring others, I feel when you're teaching others, you also learn a lot of things. And I've never had a dull moment when I was mentoring or helping someone else. It sort of gives some satisfaction. And I was fortunate to find some good mentors in my life as well, who are helpful and help me to transition, be better in the technology side, what I'm doing. So I felt at one point I was being approached by a few people, and they really wanted to get some guidance and help. So I tried to do that and got to hear they got benefited out of it. Then it gradually made sense to why not volunteer the time and at least dedicate some time in a month and help the upcoming engineers. And from then I've met some wonderful people, helped few of them, mentored, coached. Uh, it's just that, it's just the building your ecosystem, building the upcoming engineers, just giving back to what I have got before, and just having that healthy environment everywhere. And it's been wonderful so far.
That's amazing. Vivek, thank you so much for speaking with us today. The last question here is, who from our community of healthcare professionals and IT professionals should reach out to you? And what's the best way to reach you?
Sure. LinkedIn is always best. I'm very active in LinkedIn, so feel free to reach out to me in LinkedIn. I will be more than happy to connect with you and help in any capacity I can. So, thank you.
Awesome. Links will be in the description, folks. Thanks for listening to another episode, and we'll see you all next time. Thank you.
Thanks, Jeremy.